Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of internal medicine is Pancreatic Neuroendocrine Tumors. We will discuss this topic in 5 sections. In the first section, we will discuss about the gastrinoma. What is gastrinoma? How we diagnose the condition known as gastrinomas and how we treat gastrinomas. Then in the second section, we will talk about the features of insulinomas and glucagonomas, how we diagnose insulinomas and glucagonomas. And then in the third section, we will talk about the somatostatinoma syndrome. What's the diagnosis and treatment of somatostatinoma syndrome? And then also another condition known as the VIPomas. So somatostatinomas and VIPomas will be discussed in our third section. Then in the fourth section, we will talk about the non-functional pancreatic neuroendocrine tumors, GRFomas, and then also some rare pancreatic neuroendocrine tumor syndromes. In the fifth section, finally, we will talk about the localization of the tumor localization, how we can do the different diagnostic tests for the tumor localization, how we treat, what are some specific anti-tumor treatments for the treatment of all these pancreatic neuroendocrine tumors, and also the peptide receptor radionuclide therapy. So all this about the pancreatic neuroendocrine tumors will be discussed in our today's lecture. So keep watching sqadia.com.